This journey had to incorporate technological advancements over the last 20 years, from simple system integrations with our sister companies, making authorizations happen real time, making claims happen real time, to exciting robotic implementation where you can reduce the turnaround time of your prescriptions from 5 to 7 days to 1 to 2 days from receipt to delivery. Most importantly is access to medication. So there's a lot of patients with chronic disease out there. A lot of our patients are in rural or deep rural areas, do not have access to pharmacies, and the beauty of delivering directly to their address of choice makes it more accessible to patients to have their chronic medication every day, to take it to keep them healthy. So access to affordable healthcare is the motto of Pharmacy Direct. We do that through the integrated value chain, every step of the way, from diagnosis of your disease through to the doctor prescribing your medication, through the authorization with your medical aid, through the dispensing and then the delivery of medication, and continuing with the cycle of medication through every 6 months checkup by your doctor.
In line with what Ansi has already alluded to, the core purpose here is to drive affordable healthcare, access to that care, and also improve the health outcomes and the experience of the member, who she has already mentioned is at the center of this. So if you look at this initiative particularly, what we are able to really do is to ensure that through the data that we have on our side from an authorization perspective, we are able to integrate with our sister company PD to be able to ensure that then they are dispensing the script in line with the chronic conditions that our members in the ecosystem that have chronic conditions require. We've got 1.2 million of those members out of our 3.9 million lives. So that's quite a significant portion, and that drives a significant healthcare cost. So if we can improve their experience in how they access their medication, and it improves their compliance to that medication or adherence, what you end up seeing is that obviously there's no break in the therapy, like she said, so the experience is seamless. Their outcomes improve from a health perspective. Just to quote maybe 3 conditions, we have seen for members in this program that we've got as much as 26% reduction in hospitalizations for type 1 diabetes people, 34% for type 2 diabetes, and 14% for epilepsy. So these are significant health cost impact, because 65% of our healthcare cost is hospital related. So if we can make an impact there at the cost level, but also the outcomes themselves are improving, and the experience of the member, just like Ansi said, we're able to deliver to everyone in the most remote of the locations in this country, then you've got this value-based delivery of care that is really improving the entire system at large. So we are using data to understand all of that and combine it with our integrated value chain model to be able to drive this delivery of care to the member.